morning everyone. Have a great day for everyone. Let's start our class. The terminologies of obstetrical gynecology. Miscarriage. Miscarriage is the spontaneous end of the pregnancy before 24 weeks. That is known as miscarriage. So some of the signs you can observe in the miscarriage. What is that? Lower back pain or abdominal pain. Lower back pain or abdominal pain. Different pain may can occur according to the condition. Dull pain, sharp pain or cramping. Any of the pain can occur in the miscarriage. So dull pain means it is the chronic and persistent pain. Sharp pain means it is the sudden pain which is occurring in the site. Cramping means it is the painful involuntary contraction of the muscle. So any of the pain can occur. Another is tissue or blood clot can be passed from the vagina. Okay, any of the tissue or the blood clot-like material which will be passing from the vagina. That is one of the signs for the miscarriage. And another is vaginal bleeding with or without pain. So these are the main signs which you can observe in the miscarriage. What are they? Lower back pain, abdominal pain, it may be dull, sharp or cramping. Tissue or any blood clot can be passes through the vagina. Vaginal bleeding can occur. It may be stillbirth. Stillbirth means the birth occur after the viability age, but there is no vital functions like heart rate and the placental pulsation. That means the baby has or the infant or the fetus has died inside the womb itself and they survived at least for the 28 weeks. That is known as stillbirth. The baby has or the fetus has already died inside the womb itself. That is called stillbirth. Ectopic pregnancy. Ectopic pregnancy is also called as excisis. What is that? ECCYESIS. It is also called as excisis. Ectopic pregnancy or excisis. And what is happening in this ectopic pregnancy? The embryo which is implants in the outside of the uterine cavity. Normally it is implants inside the uterine cavity, right? So in the ectopic pregnancy, the embryo will be attached to the outside of the uterine cavity or it implants in the outside of the uterine cavity. It may be in the cervix, it may be in the abdomen, anywhere of the other parts or it may be in the fallopian tube. So that is known as ectopic pregnancy. Most of the condition in the ectopic pregnancy occurs, the implantation occurs in the fallopian tube. But it can occur anywhere. And the most symptoms you can observe for the ectopic pregnancy, that is lower back pain during maturation. While passing the urine, they feel low back pain. And another is they will feel low back pain once the bowel movement occurs. And another thing is vaginal bleeding. These are the main symptoms they can observe in the ectopic pregnancy. There are 4 types of ectopic pregnancy. What are the 4 types are there? Tubal pregnancy, non-tubal pregnancy, heteropic pregnancy and persistent ectopic pregnancy. Okay, what is that? Tubal pregnancy, non-tubal pregnancy, heteropic pregnancy and persistent ectopic pregnancy. These are the 4 types of ectopic pregnancy. What is this tubal pregnancy? When the embryo implants in the fallopian tube, that is known as tubal pregnancy. Once the embryo implants on the fallopian tube, that is tubal pregnancy. Once the embryo implants any cervix or intra-abdominal cavity or ovary, that condition is known as non-tubal pregnancy. Okay, and another is heteropic. That means there will be 2 fertilized egg. One will be implants inside the uterine cavity and another will be implants in the outside of the uterine cavity. That is known as heteropic pregnancy. Okay, 2 fertilized egg will be there and one will be inside the uterus and another will be outside the uterus. That is known as heteropic pregnancy. And another is persist ectopic pregnancy. That means already the surgical intervention has taken for remove the ectopic pregnancy, but still the trophoblastic growth is continuous. That is known as persist ectopic pregnancy. Another terminology is hyperemesis or hyperemesis gravidarum. That is HG, hyperemesis gravidarum. Okay, so it is the condition of severe nausea and vomiting. That means severe morning sickness. So once it is increasing the vomiting and nausea, what will happen? It will prevent the adequate intake of the food and fluids. So the hypoemesis is the severe morning sickness, and it may be due to the presence of increased level of human chorionic gonadotropin, that means HCG, human chorionic gonadotropin. Pruritus gravidarum. Pruritus means itching, right? So it is the condition of getting itching during the time of pregnancy. That is called as pruritus gravidarum. And another terminology is postnatal blues. Postnatal blues, the pregnant woman after the delivery, they feel mild depression. So that is known as postnatal blues. And postpartum depression, after the delivery, the woman feel complete depression. So that is known as postpartum depression. Antepartum hemorrhage. It is also called as prepartum hemorrhage. Okay, antepartum hemorrhage or prepartum hemorrhage. What is happening in this? It is the vaginal bleeding from the 24th weeks of gestation to term. 24th weeks of gestation to term is the bleeding from the vagina. So it is one of the medical emergency case, and the woman should be sought for the immediate treatment. Postpartum hemorrhage. The loss of blood after the hemorrhage occurs after the delivery. So it is about greater than 500 ml of blood loss after the vaginal delivery. That means the greater than 500 ml loss of blood following vaginal delivery. And in the cesarean cases, it's about 1000 ml of loss of blood. That is known as postpartum hemorrhage. That means the hemorrhage occurs after the delivery. It may be about 500 ml or greater than 500 ml following the vaginal delivery. In the cesarean case, maybe it is 1000 ml or more than 1000 ml loss of blood. That is known as postpartum hemorrhage. Pregnancy include hypertension. It is also called as gestational hypertension. Okay, pregnancy include hypertension or gestational hypertension. It is the condition of high blood pressure during pregnancy. We'll see the types of pregnancy include hypertension. What are the types? Chronic hypertension, gestational hypertension, and pre-eclampsia. Chronic hypertension, gestational hypertension, pre-eclampsia. So this chronic hypertension means the hypertension, that means the blood pressure increased about or more than 140/90 before the pregnancy. It may be occur before the pregnancy or early stage of the pregnancy, that means 24th weeks of gestation or after the delivery. Okay, so the increased blood pressure, that means it is about 140/90 or more than 140/90 before the pregnancy, early pregnancy or after the delivery. That is known as chronic hypertension. And another is gestational hypertension. Gestational hypertension means the hypertension occurs at the 20th weeks of gestation and it will disappear after the delivery. Okay, that is known as gestational hypertension. It is occurring at the time of gestational period, that is known as gestational hypertension. It is disappear after the delivery. And another is pre-eclampsia. Pre-eclampsia, it is the condition of both chronic hypertension and gestational hypertension, and that can lead to the severe condition after the 20th week of gestation. And also can observe the protein, increased level of protein in the urine in the condition of pre-eclampsia. Another terminology we can learn, that is eclampsia. Eclampsia, it is the acute and life-threatening condition, and what is happening in this, there is a chance for getting the tonic and clonic seizures for the woman who is pregnant. Okay, it is not due to any pre-existing condition of the seizures or not due to any organic brain disorders. Only it is occurring during the time of pregnancy, that is known as eclampsia. Okay, so tonic and clonic seizures occurs, that means the patient will get unconscious and the violent involuntary movements of the muscle will occur. That is known as tonic clonic seizures. Torch syndrome. Okay, it is also called as torches or torch infection. It is the medical term which is the letter which is using for the septoperineal infection. So what are these infections which indicates each letter? That is T4 toxoplasmosis or toxoplasma gondii. O for other infections like Coxsackie virus, syphilis, varicella zoster, or HIV. And hepatitis B also comes under the other infection. But hepatitis B is large virus and it cannot cross the placenta, so it will not infect the infant. And another is R for rubella, C for cytomegalovirus, and H for herpes simplex virus 2. Okay, so T for toxoplasmosis, O for other infections, R for rubella, C for cytomegalovirus, H for herpes simplex virus 2. So it is TORCH syndrome. It is the set of perennial infections. Maternal mortality. Maternal mortality is the death of pregnant woman, or the death occurs after the 42 weeks of after termination. So the death occurs for the woman during pregnancy, or the death occurs after 42 weeks after the termination. That is called as maternal mortality.